Medicare, Medicare Advantage, Part C, Part D, Medicare supplements. It's like navigating a maze, right? You've heard about it in the news, you've read about it on social media, and if you've been paying any attention, you might be thinking that Medicare Advantage plans are the villain of the story.
Here's how the government screws you. You know Medicare Advantage? It's neither Medicare nor an Advantage.
That it is neither Medicare nor is it an advantage.
But is that really the case? Well, my name is Cameron Giardini, and I help operate our independent insurance agency called Giardini Medicare, where we specialize in helping consumers with their transition to Medicare. Today, we are going to demystify Medicare Advantage plans. We will uncover what they truly are, the pros, the cons, and more importantly, whether or not they might actually be a right option for your coverage when you're eligible for Medicare. But first, we want to remind you that we now have a brand new free online course that includes every Medicare topic we could think of and more so you can learn at your own pace. To access this course, just go to gmedcourse.com and register there. So let's start by understanding what Medicare Advantage plans are. They are often referred to as Part C of Medicare, but they are not actually a part of Original Medicare, and they are not provided by the federal government, but instead they serve as a private alternative to Original Medicare, which Original Medicare is composed of both Part A and Part B. These Medicare Advantage plans, they are actually bundled packages that include covered benefits with Part A, which covers hospital services, and Part B, which covers most outpatient medical services. And many plans will also include Part D prescription coverage. So think of Medicare Advantage plans as an all-in-one package of Medicare benefits, while at the same time being a private alternative to Original Medicare. Now you may ask, how do these plans function and what is their relationship with Original Medicare? Well, if you're enrolled in a Medicare Advantage plan, the vast majority of your healthcare services for Part A and Part B are going to be administered directly through your Medicare Advantage plans instead of Original Medicare. What this means is your red, white, and blue Medicare card will take a back seat to your Medicare Advantage plan.
Get in the car. Get in the back seat.
Which again is provided by that private insurance company. That is going to become the source of your Medicare coverage. In other words, Medicare Advantage becomes your primary coverage. But remember, these Medicare Advantage plans, they still have to follow rules set by Medicare, and they must cover at least the same services as Original Medicare. This brings us to the role of private insurance companies in the Medicare Advantage space. These plans are offered by private insurance companies who are contracted with the federal government. Essentially, the government pays these companies a large sum of money to administer your Medicare benefits. Because Medicare Advantage plans are administered and managed by private insurance companies, this may cause them to require prior authorization before you can receive certain types of care, which we will discuss in much more detail very soon. These plans also provide some additional benefits not covered by Original Medicare. This is heavily advertised online, on TV, and even in your mailbox.
Medicare Part C plans with extra benefits.
So the private insurance companies play a key role in offering these additional benefits and managing your care under a Medicare Advantage plan. While Medicare Advantage plans have their benefits, like all things in life, they also have their downsides. If you look at Medicare.gov and other sources, you will see that Medicare Advantage plans, they must cover medically necessary services and supplies that Original Medicare covers. But what is often overlooked is that Medicare Advantage plans, they might require additional processes and oversight before covering these services, which again, this is mostly done through the process of prior authorization. So according to the Kaiser Family Foundation, prior authorization is designed to ensure that healthcare services you receive are medically necessary. Providers must obtain approval before a service or benefit will be covered by your insurance plan, and this can sometimes lead to delays in getting the care you need, and in some cases, insurers may not approve the service that a doctor recommends. Another potential downside is a requirement for referrals to see specialists with Medicare Advantage plans. Depending on your Medicare Advantage plan, you may need a referral from your primary care doctor before you see a specialist within your plan's network. This adds an extra step to the process of seeking treatment, but understand that this is not a requirement of all Medicare Advantage plans, and in our personal experience, it is becoming less and less common. Speaking of networks, Medicare Advantage plans, they often come in the form of health maintenance organizations, which are HMOs, or preferred provider organizations, which are PPOs. Of course, there are other types of plans with Medicare Advantage, but these are by far the most common. Because Medicare Advantage plans are provided by private insurance companies, they also have contracted networks of medical providers as well as facilities in their networks. This can be both a pro and a con. So the pro is that having a network can help control overall cost, and the downside is that, of course, the network can limit your choice of providers. And it's important to note that these networks can change at any time throughout the year, meaning a doctor who was in network when you enrolled might not always remain in network. Now, this is not typically common, but it is also not unheard of by any means.
The St. Charles Health System is considering dropping Medicare Advantage.
But Vanderbilt says they will soon no longer accept Humana or WellCare Medicare Advantage plans.
Another potential disadvantage is the possibility of higher out-of-pocket medical costs when compared to Medicare supplements. While Medicare Advantage plans have low monthly premiums, typically you might face higher costs when you actually need medical treatments. During 2023, the maximum allowable out-of-pocket limit for in-network covered services with a Medicare Advantage plan is set at $8,300 for the year. Although many plans have maximum out-of-pockets that are lower than this amount, in general, the max out-of-pocket is good to keep in mind when you're considering potential healthcare costs for the year with Medicare Advantage. Lastly, we must remember that Medicare Advantage plans, they are yearly contracts. This means that beyond the current calendar year, the copays and benefits for your plan can and likely will change. And by calendar year, we just mean from January 1st until December 31st. Now, these changes, they could be minor or they could be substantial. It really depends on the plan year. It is crucial to stay informed about any changes in your plan so that you're not caught off guard. So up to this point, we have talked about the potential downsides of Medicare Advantage plans, but it can't be all doom and gloom. There are ways to navigate these challenges effectively so that you might make Medicare Advantage coverage work for you. Let's start by talking more about prior authorization. First, it is crucial to understand and acknowledge that there is simply a possibility or even a likelihood that during your time enrolled in a Medicare Advantage plan, your insurance company could require prior authorization from your medical provider before covering a treatment or procedure. And it is not guaranteed that this request will be approved. Of course, we all hope it doesn't happen, but pretending prior authorization doesn't exist, it's not going to help anybody. Just like pretending it is the worst thing ever created is also not helpful. With that being said, let's briefly look at some of the numbers. First, it is important to understand that if you enroll in a Medicare Advantage plan, it is unlikely that you will need prior authorization to receive basic treatments and procedures. Instead, these cost-saving methods are usually reserved for more expensive medical procedures, which are reflected by the chart you can see here, created by the Kaiser Family Foundation. This shows that at least in 2022, there was a much higher prevalence of prior authorization for procedures with higher out-of-pocket costs. In general, the concept of prior authorization itself is really not the problem in the system. On the surface, it is simply a procedure to save insurance companies and the Medicare system money by making sure that Medicare beneficiaries are only receiving necessary care. Of course, that would be if everything went to plan. Wouldn't that be nice? However, according to a 2022 report done by the U.S. Office of Inspector General, and we will provide the full link to this report in the description below, it found that of the prior authorization requests that were denied, 13% of those denials actually met Medicare coverage guidelines, which means they should have been covered under original Medicare's coverage criteria. Instead, the insurance company that administers the Medicare Advantage plan in these cases, they denied services based on their own internal criteria, which is not how the system or the process is supposed to work. The Centers for Medicare and Medicaid Services, they did release a final rule in April of 2023, which states that beginning in January of 2024, according to CMS, this new rule is designed to ensure that people with MA, which is Medicare Advantage, receive access to the same medically necessary care they would receive in traditional Medicare. We truly hope this becomes a positive change for everybody enrolled in or considering a Medicare Advantage plan. You can also find a link to this final rule in the description below. But for now, we will look at some more prior authorization data. Overall, how much is prior authorization relied upon in the Medicare Advantage system? Well, again, according to the Kaiser Family Foundation, when they looked at 87% of people enrolled in a private Medicare Advantage plan in 2021, they found that there were 35.2 million instances of prior authorization requests, which ends up being about 1.5 requests per enrollee during the year that they were studying. Of these 35.2 million prior authorization requests, 2 million of them were denied in part or in full. This represents 6% of prior authorization requests being denied, and a majority of the denials were actually full denials. Now, just a quick example of a partial denial, that could be if your doctor says you need 10 physical therapy sessions, but only 5 sessions are approved. That is an example of a partial denial for prior authorization. So what can you do if you find yourself facing a denied prior authorization request? The most important thing for you to know is that you can appeal a prior authorization decision that you disagree with.
Objection!
According to KFF, the 2 million denied prior authorization requests, of those, only 11% were appealed. But more importantly, 82% of those that appealed that initial denial, it actually resulted in that initial decision being partially or fully overturned. So if you disagree with the decision, don't hesitate to appeal. And if you enroll in a Medicare Advantage plan with an independent broker, they should be able to help you navigate this prior authorization process. Prior authorization is very important to understand, but now we will move on to other potential downsides of Medicare Advantage coverage. Many people dislike the thought of needing referrals to see specialists with a Medicare Advantage plan, but if the idea of needing a referral to see your specialist bothers you, you might be able to combat this by considering a PPO or even an HMO plan that does not require referrals. Not all Medicare Advantage plans, not even all HMOs, require referrals. Plus, just based anecdotally on our own experience helping thousands of people with Medicare Advantage plans, the trend seems to be moving toward fewer referral requirements. Nevertheless, a PPO plan might give you more flexibility, often allowing you to see in-network healthcare providers without a referral. But understand that if your plan does not require referrals, it might still be a good idea to consult with your primary care physician to coordinate your overall healthcare treatment. That is their role, and they can be very helpful for your overall health. Another aspect of Medicare Advantage plans that can scare or deter consumers is the fact that unlike with original Medicare, Medicare Advantage plans, they do have those networks of providers and facilities that are contracted with the plan. These are the providers you may likely have to use. One of the key things to do before enrolling in a Medicare Advantage plan is to check your preferred doctors and hospitals. Make sure they are part of the plan's network. Although some people want to convince you that Medicare Advantage plans, they have very small networks and they will prevent you from seeing providers you want to see and make you change your doctors, that is simply not true in most parts of the country and in most circumstances. It is all about finding a plan that does have your providers in network. And although it may not always be possible, it is always worth checking before dismissing the idea altogether. A lot of the issues we see with Advantage plans are when people enroll without checking networks, and that is where they say, oh, well, my doctor didn't take it or it didn't work well. It's because they did not check to verify that their specific providers were part of that plan's network. Even if you travel, you might be able to find Medicare Advantage plans with national networks and providers across the country, or you can consider PPO plans with potential out-of-network coverage. Remember, if you have had any type of health insurance before Medicare, it's very likely you have already been enrolled in an HMO or a PPO plan, which has a network of providers, and really this concept is no different. Just keep in mind that PPO plans, they are not a ticket to see whatever provider you want without restrictions. Outside of emergency and urgent situations, out-of-network providers, they do not have to treat you if they do not want to, even if you have a PPO plan. So what about the higher out-of-pocket potential for medical costs with Medicare Advantage plans compared to Medicare supplements? This is certainly true in most cases. Medicare Advantage plans, they do have a cap for members spending, like we talked about, which again is set for $8,300 for in-network services in 2023. This is known as the maximum out-of-pocket limit. It is important to note that this is just the maximum limit, and it's not the actual limit for all plans that they have to set it at. It's simply the maximum. Many people will use that maximum number as a shock factor to deter Medicare Advantage enrollment, but let's just say in Michigan, for example, it is very common to see plans with a maximum out-of-pocket at least a couple $1,000s less than that maximum. So make sure you check plans in your actual market. There are even markets out there with very low out-of-pocket maximums that you might be surprised by, much lower than Michigan. Also, just know that the vast majority of consumers do not actually reach their maximum out-of-pocket limit. So although it is good to budget for and maybe plan for it, don't think you're guaranteed to reach that by any means. It is going to depend on your level of medical needs and the procedures you have throughout a year. Lastly, at least Medicare Advantage plans do have a maximum out-of-pocket limit, unlike original Medicare, which does not have that same out-of-pocket spending cap. Our last Medicare Advantage downside is the fact that yes, Medicare Advantage plans, they're yearly contracts, And yes, your plan's copays and benefits can change from one year to the next. But keep in mind that you can also change your plan every year without health questions. Your plan will send you an annual notice of change, or an ANOC, in September. This lets you know about upcoming changes, and then you can compare your options and adjust your coverage as necessary during the fall annual election period, which is October 15th until December 7th, as well as potential other enrollment periods and special enrollment periods throughout the year. Now that we've navigated the potential downsides and how to address them, let's shift our focus to some of the compelling benefits for Medicare Advantage plans. First and foremost, these have to be the extra benefits not usually covered by original Medicare. Medicare has made it so we can't really get into details about these benefits during this video, but instead, here is a chart from the Kaiser Family Foundation which shows the most common extra benefits that are provided by Medicare Advantage plans. Another positive benefit of Medicare Advantage plans is their low monthly premiums. In fact, according to KFF, again, in 2022, 69% of Medicare Advantage plans had a monthly premium of $0, and a staggering 99% of Medicare beneficiaries had access to at least one $0 per month Medicare Advantage plan in their county. So it is almost certainly possible to find coverage without breaking the bank, at least when it comes to monthly premiums with Medicare Advantage. Just remember, you still have to pay your Part B premiums while enrolled in a Medicare Advantage plan, so don't think you're skipping out on that. Moving on, one of the other key benefits with Medicare Advantage plans is the inclusion of prescription drug coverage. This is often included at no additional monthly cost, although you will still have to pay out of pocket for your prescriptions. So although these plans provide drug coverage, don't fall into the trap thinking it means all of your medications will be no cost. Another significant Medicare Advantage benefit is the plan's maximum out-of-pocket limit that we have already discussed. While these caps are generally higher than those for Medigap plans, they do provide at least some type of safety net that simply does not exist with original Medicare alone, and this cap can limit your financial risk and can provide at least some peace of mind. Finally, one of the key benefits of Medicare Advantage plans is your ability to switch from one plan to another without health questions. This means you can adjust your coverage to meet your needs without being denied due to pre-existing conditions. Just remember that you can only do this and switch from one Medicare Advantage to another Medicare Advantage plan during specific enrollment periods each year, like we covered in other videos and a little bit in this video. All right, let's get down to the nitty-gritty. Who might Medicare Advantage plans be right for, and who should potentially consider avoiding them? There is no one-size-fits-all answer here, but there are some general considerations that might help you with this decision. Of course, these are only our opinions, so don't use this video to make a final decision about your coverage, and instead make sure you consult with an independent broker licensed in your state to compare options. We even have a link below if you need to connect with one. So with that out of the way, Medicare Advantage plans, they can be a good fit for a number of different groups. For example, they are often an option for those eligible for Medicare due to disability, end-stage renal disease, Lou Gehrig's disease, who are under age 65. The reason for this being that in many states, Medicare supplements are simply more expensive than for people that are 65 plus in age. They can also be a good option for military veterans who rely on the VA for some or most of their healthcare needs, but would like options outside of the VA. If you want low monthly premiums and you're comfortable with the idea of potential prior authorization, and the possibility of higher out-of-pocket medical costs, a Medicare Advantage plan could simply work for you. They are also worth considering for those who might struggle to afford the higher premiums associated with Medigap plans, especially individuals with Medicaid. If you're comfortable with a network of medical providers and you have checked to confirm your preferred doctors are part of the plan's network, Medicare Advantage plans, they can simply be a good option. And lastly, if you're someone who values extra benefits not covered by original Medicare, without having to purchase these additional benefits through insurance, Medicare Advantage plans, they could be an option to provide that. On the flip side, Medicare Advantage plans, they might not be for everyone. If you don't want to deal with prior authorization, or you want the lowest possible out-of-pocket medical cost, a Medicare Advantage plan, it simply might not be the right fit for you. Likewise, if you're looking for the flexibility to see any provider around the country that accepts original Medicare, Medicare Advantage plans, they do have PPO plans, but they still don't provide the same flexibility as having original Medicare with a Medicare supplement. Like with any insurance, it's crucial to understand the limitations and structure before enrolling. One more important topic to briefly discuss involves switching from Medicare Advantage to Medigap. While it is possible to go from one Medicare Advantage plan to another Medicare Advantage plan without health questions during enrollment periods, moving to a Medigap plan, it typically includes health underwriting, and it can potentially result in a denial of an acceptance into a Medigap plan depending on your pre-existing conditions and health at the time. So, if you're considering a Medicare Advantage plan while you're healthy with the idea of switching to a Medigap plan later, be very cautious of this thinking. Always think long-term about your coverage, considering what will be right for you not just this year, but for the next 5, 10, even 20 or more years. So let's address the elephant in the room. Are Medicare Advantage plans bad? You may have heard a lot of buzz around this question, but the truth is no, they're not inherently bad. They may not be for everyone, and that's fine. It's all about matching the right plan to the right individual and their unique health circumstances and budget. We know people in the comments below will say, I would never touch Medicare Advantage. This is horrible. But guess what? There are plenty of people that have chosen this path and they're happy with it. According to Medicare, as of the beginning of 2023, just over half of eligible Medicare beneficiaries are now enrolled in Medicare Advantage plans. And that percentage, it keeps growing. So to say that no one should ever consider Medicare Advantage coverage, it just seems absolutely crazy to us. The only bad Medicare Advantage coverage is one that does not align with your individual healthcare wants, needs, and budget. As long as you thoroughly compare Medicare Advantage versus Medicare supplements, we are confident you will make a choice that is right for you, and it doesn't matter what others say.